And now we go with our conversations to Spain. Jordi, Serrano, Pons, you represent a company called Universal Doctor. That's internet-based medical
translation.
Yes.
Between other things.
Right. So what exactly you provide and how you help people to solve their medical problems?
Yeah, we started 10 years ago, even before iPhone was in the market. No, so we started with flash technology, with CDs. We had a problem of communication with immigrants, and we launched Universal Doctor Speaker like 10 years ago. Mm-hmm. We've been able to survive all the wave technologies. We started with iPhone application, Android. We have a web version. We are in more than 150 hospitals around the world. And basically what we do is improve communication between patients and doctors that don't share the same language. Mm-hmm. With that baseline, we have also been working in many other projects, based evidence mobile health apps that always have an impact in public health. So we are a specialized company. We started with the translation, that we have been working with many international organizations like WHO, World Health Organization, London School of Tropical Medicine. So we are doctors, myself I'm a medical doctor, no? And we want to work only in the things where we know we can have an impact. And we want to develop apps or projects, or it doesn't matter technology. We don't care about the app itself. Now it's an app, that can be a blockchain, that can be a chatbot, but we want to have a real impact with digital health.
So let's see, there is for example, immigrant or refugee from Syria in Spain who wants to get some medical attention. He doesn't speak Spanish. So how is your system used in that? So just describe the process.
Absolutely. We have a glossary of more than 5,000 sentences, well comprehensive and robust glossary that we've been working for 10 years. Because the problem is that we cannot have any error. Mm-hmm. An automatic translation and still voice recognition still fails. We're working with partners to incorporate that when it never fails. Mm-hmm. But in the medical field, you cannot fail. Right, so we have the medical sentences in a consecutive way. So you see, do you have fever in English or in Estonian? Mm-hmm. When you click, the audio is launched in Arabic from Syria.
So first of all, you have to log on to somewhere, right?
Yeah, somewhere. Then you are a doctor or a nurse, and you have your list of anamnesis. Mm-hmm. And then you say, I want to ask about the pulmonary function. Mm-hmm. We have dozens of sentences related to that, and you have the question, and you click, and the audio is launched in the language of the patient. Obviously, it has some limitations with a yes, no answer, some open answers, but at least for the treatment, or just to explain people, hey, you will have this kind of exploration, this kind of treatment, or we have called a professional interpreter. No, it's really very robust because we cannot fail. And we've been even collaborating with many big companies. Well, we inject our glossary in Google to compare our glossary with the automatic translation of Google, some different years. And of course, Google is improving, and we are happy. Because our business is to put one sentence after another in the conversation. If we don't have to spend money in the translation, better. But meanwhile, that really never fails. We have this comprehensive package.
How actively is your service used, and how much it costs?
Well, it's been used for the moment for more than 150 hospitals around the world. We have a freemium system. You can download the app, Universal Doctor, in the Apple Store, in the Android Store, in the Google Play, and for free. As a traveler, as a traveling medicine app, it's working very well. You go to China, you go to Japan, and you say, oh, if I have a problem, I want to explain my symptoms in the language of the doctor. Mm-hmm. But this is the free version. But then, of course, we live from, we have to earn our money. No? We have this freemium version where hospitals have the web version with thousands of sentences, with other products. No? And it depends on each hospital. And also we differentiate. Hospitals in the OCDE region, rich countries, they have to pay an annual fee, which it depends on a hospital of 300 beds or a small hospital. Very little, thousands of euros, very little for a hospital, it's nothing. But if you are an hospital from Morocco, you can have it for free. I mean, we have that model or from Senegal to that model where OCDE countries have to pay for the license, but developing countries can have it for free. I mean, it works quite well. It gives us a lot of feedback. because we're a very social company also, and we believe in that dual model.
So how do you find your page again and your company on the web?
Universaldoctor.com.
Universaldoctor.com. So everybody can go and look up.
And we are also, well, this is the baseline of projects. We've been able to implement our project in 150 different places. And in these places, we've been lucky to collaborate with new projects that have to do with public health issues, with mobile health.
Here at the conference, many companies can kind of introduce their services here to the professionals. But talking about Spain in general, we know very little about e-health in Spain here in Estonia, where we have many applications already in that field. So how far has Spain moved on this new road?
Well, Spain has, of course, 17 different healthcare systems. As a super decentralized country, so each autonomy has a different healthcare system, and even inside each autonomy, each hospital have different electronic medical records, and there is always a problem of interoperability like everywhere else. However, there are some governments, Basque governments, Catalan government, other governments of Andalusian government have developed really nice tools, no, to allow patients to connect as a medical, so to connect to the medical health record file, no, and to have access slowly to that that content, and slowly we are in the good track. In some aspects, some of our regions are very advanced, but we have a problem of interoperability between all regions, no?
So the road is still ahead. Very long road.
But we have good experiences, and I think we can learn from each other as always.
And is there feeling in Spain that people want to have those services on internet? Are they still afraid? Is it like a whole new world for them, or they're willing to go there?
Yeah, at the end of the day, we differentiate. The problem of interoperability between European countries, it's clear, and we all know that. We are all trying to fight for that. But at the same time, we almost fail to remember that in a universal health system, like our system in Europe, where people don't pay for, not directly, for their health systems, people are not stimulated. They're not consume-driven in a way, no? Like in the States, where you have your own company, your insurance company, like Kaiser Permanente and other things. Yes. In that context, we need to stimulate the demand of patients, allowing them to contribute in all these, accessing the clinical files and participating in trials, studies, in surveys where they feel that they are collaborating. If we do that slowly, because we can't invent the best, most important, nice things in the world if we don't have this consumer-drive approach. It's not a consumer thing, it's a health patient thing. If patients don't use it, or if citizens for prevention aspects don't use it, then it doesn't matter.
So it all starts not from governments, it starts from citizens. When they demand it, the governments have to go and do it.
Absolutely.
And the companies have to provide it.
Yeah, it's a balance, but we always forget here the citizens.
And who are the receivers.
The receivers, no? And I believe a lot in direct democracy, and citizens have a say. And although some governments have some constitutional interrogations, no? Because they have been elected by some citizens, but they've been elected in a program. But if you would ask directly to citizens, would you like that your health records are shared to improve science, of course with security? There are clear many surveys around the world that say that almost everyone wants these things. So we have to really make the governments work with brilliant companies like here, just to try to convince not only, and to listen to citizens that want to participate. No? And a little bit, I understand that European Union is a very complicated framework, and that's good for security reasons. But at the same time, if we don't really push the accelerator in these innovations, then we will have to ask our nice partners in the rest of the Earth, and that small dot blue that you can see from Jupiter, the Earth, that okay, the most advanced solutions will be in the States, in China, which is licit. But I believe that Europe wants to be in the forefront, no? In the cutting-edge space of this field. And I believe that that balance must be observed, but always listening to citizens and not as oh, the citizen must be in the middle, what the citizen wants. No, implicate them, and really once you have a tool, you must use it for many other policies, no? And slowly it will improve the usage. And once do you have any field where you have started using something and then it has gone back in health, in digital? I don't know any place, no? Here's an example to finish. Nurses, in some places, they have to scan the medication with the personal health record for security reasons. At the beginning, in many hospitals, these implementation projects are very difficult to implement because people are not used. Once, 1 year or 2 years later, after implementation, when the system doesn't work, nurses stop to work. So we cannot work because if it fails something, so the adaptation always requires a time. But once it works, people feel more secure. I think it's what we have to do. No?
So we hope this conference kind of advances this agenda in Europe, and thank you very much for your insight.
You're welcome. Thank you.